when there were nobody that knew about mental health, Carter Center came and started training nurses, physician assistants.
The Carter Center's role in helping to develop the mental health system in Liberia has been very, very, very pivotal.
When we started off in Liberia, at that particular point in time, there was only one psychiatrist for a population of more than 5 million.
I remember when my grandmother first told me about the work that she was doing in Liberia. I was 25, and she told me a 25-year-old Liberian would have gone through 2 civil wars and not had any support for mental health.
We trained over 360 advanced practice specialists in psych mental health that were recruited from all across this country.
I was part of the first cohort of Carter Center training. I grew the passion for mental health because you see somebody that look like they are of no use and you work with them and they become somebody better.
Over 15 years, the Carter Center has helped revise Liberia's mental health law and integrated short mental health educational programs into trainings for the National Police Force, school teachers, midwives, and tuberculosis nurses.
We've managed to train over 1,000 of those folks.
These efforts have made life better for tens of thousands of people. People like Ruth Oko, who overcame depression following the death of her mother with the help of a school-based mental health clinician. Archie Pita, who left behind a life of drugs and petty theft after he met a tuberculosis nurse who not only cured his physical illness, but convinced him that he could change. Sarah Nyanti, a young woman struggling with postpartum depression, who found contentment and a career after a midwife recognized her condition and offered help. From the beginning, the Carter Center and the Liberian Ministry of Health worked hand in hand. So much progress has been made that the country now needs much less Carter Center support.
We think a lot has been done to increase the competencies and the number of the workforce.
I'm extraordinarily proud of my colleagues here. I get choked up. I'm really proud of them. They're doing amazing things.
As part of its work to ensure the sustainability of Liberia's mental health system, the center developed a master's mental health curriculum.
We transferred what was master's level training into an institute of higher education with United Methodist University, and it meets international standards. Here in West Africa, the first.
Other countries in Africa have taken note.
We have a lot of requests that have come to us, like, can the Carter Center do what they have done in Liberia in our country? We invited them to say, come and see what we have done in Liberia. Is this something that you think you like? And they've all been impressed.
The center has begun working on mental health issues with the Ministries of Health in Sierra Leone and Uganda, with additional expansion possible.
That is really important because if you look at Africa, majority of their population, they are in their 20s, 30s, and 40s. But if you take care of their mental health care, that can actually contribute a lot towards their economic generation in the country.
Klubo Mulba is proud of Liberia's mental health successes, proud to have been part of her country's first cohort of mental health clinicians, and proud to now be part of the first group that will receive master's degrees in mental health.
Carter Center is the one that paying my school fees. Carter Center have come to our aid. They have done great things for us. They have shown the potential in us. They have made us to be able to help our generation, our people, to teach, to treat. So I'm grateful to Carter Center.